The physicians can also do any real aggressive lasers that are meant to resurface and really take some years off. Aimed at wrinkles, I mean, we have hair removal lasers, and we have lasers that target dark spots. We have lasers that can help with just skin tightening. So lasers is just, you're using a device that has energy targeting certain things. We have resurfacing lasers, which is lasers designed to do exactly what peels do, but instead of depending upon that chemical, you have a machine or device that does it. Then we have more superficial lasers. The advantage of the superficial lasers, you get over them a lot faster, you can do them more often. They're kind of more of a refresher. People don't, they hurt less, so people don't really dread them. And a lot of them aestheticians can do. Physician doesn't have to do. So your scheduling is easier to get in with us and work around your own schedule. Welcome to Plasticose, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kym Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Welcome back to Plasticose. I'm Kym Anderson, joined here with Dr. Christopher Park, and we're answering every question you have on plastic surgery. Dr. Park, you have what you call the med spa. Tell us a little bit about that.
Plastic surgeons do surgery and non-surgical stuff, but I decided to have its own little entity, Med Spa at the Park, which addresses things with both technology as well as hands-on treatments. There's certain things that the aestheticians do, such as facials and peels, and then we have physician-directed stuff, which are like we do our own, all the injectables, whether it be a neurotoxin, and then fillers, which are things to volumize in different ways. Those the physicians do. Physicians also do any real aggressive lasers that are meant to resurface and really take some years off with the skin. Aimed at wrinkles, I mean, we have hair removal lasers, and we have a brand new one called Splendor. Much, much faster, much less painful, and works a lot better. All good things. And people that have had it just say it's night and day versus the old laser. We have lasers that target dark spots, hyperpigmentation, melasma, lentigines. So their goal is to target those browner things and pull them out of the skin, and they actually ultimately flake off a few days later. We have lasers that can help with just skin tightening. So lasers is just, you're using a device that has energy targeting certain things. Lasers is a variety of options, and it's hard to get into all of them, but essentially we have resurfacing lasers, which is lasers designed to do exactly what peels do, but instead of depending upon that chemical, you have a machine or device that does it. With the laser, you can adjust every pulse, go weaker or stronger, and you can also target it to where it's broken up into little beams of light, so you can go deeper in those little beams and have the normal skin around it to help heal, where if you went that deep everywhere, it would take 8-10 weeks to heal.
Talk about the laser hair removal, because I had laser hair removal done, I want to say, in the underarms back in 1997, and it burned so bad. I walked around with my arms up for like 2 weeks, and you were saying that you don't have that problem anymore. I
mean, we did up until recently. I mean, and laser hair removal does hurt. The darker the hair, the weaker you have to go on the laser, because it zaps pretty good, and it can actually get so hot that it works better on darker hair, but the more interaction you get, the hotter it gets. So we use weaker settings in darker hair and darker skin. But no, this new laser just hurts a lot less. It's a lot faster, and it's got a cooling component to it before the treatment. That's mainly what you feel.
And how long does the hair just stay gone before it starts growing back?
Well, so we call it hair reduction. We try to, rather than hair removal, because you can only damage the hairs that are actively growing, which is called the anagen phase. And our hair is in telogen phase, which is not doing much for 80 to 85% of the time. So the only ones you're treating at any one specific time are those 10 to 15%. Now, that doesn't mean the laser won't singe off the other ones, but it's not actually damaging the follicle. The way we want it to work is you got that follicle, like a tulip bulb or a bulb with grass down in the bottom. If that gets hot enough, it burns the follicle around it. And then it can't grow again ever. But that's only for the ones that were in active phase. So you usually have to come back on a cycle, and everybody's cycle's different, so it's a little guesswork, but about every 5 to 6 weeks, multiple times, and hopefully you eventually get all those active hairs. And so, we used to tell people 5 to 8 treatments. With this new laser, it seems like it's going to be more like 3.
All right, well, let's talk about some of the lasers that remove wrinkles.
So yes, I mean, we have what in my mind, to keep it real simple, we call it deep resurfacing lasers and superficial resurfacing. And the deep is generally CO2, carbon dioxide, and it is completely adjustable. So I mean, it's not one size fits all. I mean, we can adjust every feature of that device and go different depths. And we'll usually go stronger around the thicker skin, which is around the nose and the mouth, than we do on the rest of the skin. And essentially, you are burning the skin in a controlled fashion. And when things are burned, they tighten up and it makes a nice change. Then we have more superficial lasers. The advantage of the superficial lasers, you get over them a lot faster. You can do them more often. They're kind of more of a refresher. People don't, they hurt less, so people don't really dread them. And a lot of them aestheticians can do. The physician doesn't have to do. So your scheduling is easier to get in with us and work around your own schedule.
In all these procedures, you do have to have multiple. It's not just one procedure is all cure-all.
So you're going to benefit from just one, but yes, multiple is better. And the main thing with what we're talking about, this resurfacing laser, and it's hard to explain on a podcast rather than visually, but if you imagine a blanket, so the old lasers, the original lasers and the original peels, it's like treating the whole blanket. Whereas with the fractionated laser, it's like sticking a fork all over the blanket. Okay, so the skin in between is not damaged. It's normal. It's not even burned. So you can go a lot deeper and that skin will heal faster. If your skin doesn't heal within 10 days or so, you're going to have scarring. So you can't go deep and treat all of it. So you break it up.
Okay.
And so because you're breaking it up, though, you need to do a series of treatments so that you get every area.
That makes a lot of sense.
And another technology train that we're on right now is microneedling. So the same way we talked about fractionating lasers into different beams, we can use needles to cause the same trauma without any burn or thermal injury. And so it still leads to some dermal tightening, but it's not a laser. So what we have now is we have regular microneedling. There's a couple different brands. Our favorite one right now is SkinPen, and it's putting little tiny holes that lead to tightening. We also have Secret, which is microneedling. The little needles go through the skin, and then it heats up at the tip. So that leads to all that same stuff we talked about, collagen tightening, dermal tightening, elastin, but it doesn't do anything to the outside of the skin. So those people have almost zero downtime, and you can still get similar benefits to the laser. It's also safer in patients with darker pigment. Darker skin patients are prone to forming dark scars when you laser them, and this is not doing anything. So that's an awesome new treatment.
Now let's talk about tattoo removals. A lot of people get them, and then let's face it, some of them after they get them, they're like, why did I do that?
Absolutely. I mean, they're unbelievably common these days, and just at least half those patients want it gone later. And the options, of course, you think about surgery if that's an option, but to do surgery, they have to be small enough to cut out and sew up, and some people want that. And I don't know if you know this, but in the military, you cannot have a tattoo when you join the military. So I've had patients who are gung-ho about joining the military and cannot get in, and so sometimes we have to remove them for that purpose. And a lot of times we will treat those surgically. Like they can get in with a scar, but they can't get in with a tattoo. But if they're too large to remove, then laser therapy is the best way to go about it. And what we're doing there is we are targeting the pigment with a laser, trying to pulverize it into smaller pieces. And then the body kind of clears the pigment. It's not a magic eraser, but you treat the tattoo, it'll bust it up, and the body will come in with its own normal healing process, the same as if you skinned your knee or anything else, and clear those things out with macrophages and phagocytes and those sorts of things. We usually use a Q-switched YAG, which is a big advance in laser therapy, and that helps break it up. Now, certain colors don't go away as much. The different depths of the tattoo. So the biggest problem we deal with is that these are done in tattoo parlors all over the world, and some pigment is put in superficially, and some is middle, and some is deep. So sometimes we'll get an unbelievable response. Sometimes we'll just get that top layer and find another color underneath or an old tattoo underneath. There's all sorts of things that can go on. So it's not the most predictable thing we do, but it is. We can definitely start fading it, sometimes very, very well, very quickly.
When you say start fading it, so that means it's going to take several procedures.
Yeah, so I mean, we always say it's going to require multiple. I mean, I've seen some amazing results with the first treatment and had people not come back. But in general, yes, you are busting up some of that color each time and letting the body clear it and letting the body heal in between, waiting about a month in between to let that process go away. And, depending on how aggressive you are to treat them, it may actually get red and moist and blistery while it's healing. So you got to wait for that to go away. I think of it as a fading process. But again, sometimes we get a dramatic fade. That's what we want, of course. But you don't know until you start treating that patient. Every ink the brands of ink matter. The Colors matter. How deep they were put in. All these things.
All right. So if you know you don't want to keep a tattoo forever, think twice before you go get one.
Absolutely. That's the easy answer.
All right. Now let's talk about leg veins or varicose veins. You see men and women with them a lot. Some of them think that they're very unsightly. Other people want to live with them. How do you make that vein go away? This vein, how do you make it go away?
So veins are, tend to get prominent in our legs as we age. And that's because their job is to pump blood back up against gravity using valves that the blood is shot up but can't come back past the valve. And so when your muscles when you flex your muscles, when you walk, those sorts of things, it pushes the blood up and it can't come back. That's essentially how it works. As we age, those valves can go bad. And some people have very bad incompetent valves, is the medical term. And they're going to get those varicose veins, that are large and obvious. All of us get them as we age, and then women get big exacerbations with pregnancies just because the pressure on the vena cava, which is the huge vein in our abdomen, the more you push on that, the more it slows everything down. And so therapy is, we used to get injections, and you still can. That's called sclerotherapy, but lasers have helped us a lot. And so for the smaller veins, we use laser therapy, usually a YAG or a Q-switch YAG laser, to target those. And you're trying to make them clot and quit flowing. And if they quit flowing, then they solidify, and they're never going to work again, and the body eventually absorbs that. But these are the small superficial veins. Your deep veins that drain your leg and drain your foot are still fine, and they actually work better if you get the blood back into those healthier veins. Things are going to go better. Now, true varicose veins, that look like your pinky or your thumb sometimes, usually have to be treated in a different manner. They can be removed surgically, which is what we used to do, but now there's a lot of endovascular treatments. I don't do them myself in my practice, but there's radiologists and vascular surgeons that go up in the veins and burn them from the inside, usually using radio frequency. But again, you're only treating those diseased veins, and you're leaving the deep venous system alone, so you're not impairing future.
So it's not going to cut off all your blood flow, and all of a sudden you're going to be walking on the street and you're going to just fall out and collapse?
Absolutely not.
All right, so it's something that people need to look at and consider if they don't like the way that their veins look on their legs.
Correct.
All right, so if somebody wanted one of these treatments, they have to make an appointment, and you, of course, got the med spa right there.
Yeah, we get people that walk in off the street, but opportunity or availability may not be present. So absolutely make an appointment. They're not all physicians, so it's easier to get in. We've got 3 aestheticians that can help people. They all have their own little areas of expertise, and we'll be happy to set that up for them. So you just do it either by walking in, calling in, or emailing.
All right, we could talk about this all day long, but we are out of time, so we have to wrap up this podcast. Thank you so much. Again, give us the email, the web address, and the phone number where people can get in touch with you and ask you specific questions.
Absolutely. The easiest ones are info@mprsd.com, which is the website, mprsd.com, and phone number 251-340-6600.
All right. Thank you, Dr. Christopher Park.
Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.